One person in 2000 suffers from a microdeletion of chromosome 22 that can lead to the development of psychotic disorders. In addition to symptoms such as hallucinations or delusions, psychotic disorders also comes with a progressive decline in intelligence quotient, IQ. If current drug treatments are successful in containing psychotic symptoms, nothing can be done to prevent the deterioration of intellectual skills that leads to loss of autonomy. Researchers at the University of Geneva, UNIGE, Switzerland, have discovered that prescription of selective serotonin reuptake inhibitors, SSRIs, a class of drugs used to treat anxiety and depression in late childhood, can reduce the deterioration of intellectual ability. This study, to be read in the journal Translational Psychiatry, opens up a new field of research and new hope for people affected by the microdeletion of chromosome 22. The average IQ is around 100 points. However, for people who may develop a psychotic illness, such as those with a microdeletion of chromosome 22, the average drops to 70 to 80 points. The problem is that when a psychotic disorder occurs, such as schizophrenia, the brain frontal lobe and the hippocampus are particularly affected, which leads to the gradual deterioration of already below average intellectual capacities, explains Valentina Mancini, a researcher in the department. 200 patients followed over a 20 years period reveal a possible solution. The team of Stéphan Eliez, professor in the Department of Psychiatry at UNIGE Faculty of Medicine, has been following 200 patients affected by the microdeletion of chromosome 22 for the past 20 years. This figure rises to 15 IQ points for those who develop psychotic disorders. Yet the physicians noted that 2 to 3 teenagers a year are exceptions, and even gained IQ points. Two observations caught their attention. The first is the prescription of small, regular doses of SSRIs, a drug that increases the levels of serotonin, a neurotransmitter involved in the regulation of behavior, in late childhood and throughout adolescence. And the younger the patients received this treatment, at around 10 to 12 years of age, the more the frontal lobe and the hippocampus, and therefore the intellectual capacities, were preserved from deterioration caused by the psychotic illness. The second observation is that a neuroleptic drug, prescribed in small doses to control psychotic symptoms such as hallucinations or delusions, also seems to have a positive effect, a promising discovery for the future of people at risk of psychosis. This study provides for the first time an indication of a neuroprotective preventive treatment for the development and preservation of IQ. Once the results of this study are confirmed, the effect of SSRIs could be tested on other types of patients and possibly prescribed preventively to people at risk of intellectual deterioration. The Geneva team will now compare the results obtained from their research cohort with international databases in order to confirm the neuroprotective role induced by these treatments prescribed at the end of childhood, adolescence being the critical phase for the onset of psychotic diseases. Story source: materials provided by Université de Genève. Note: content may be edited for style and length. Thanks for watching. Please subscribe my channel for more updates.